Heart failure occurs when the heart is unable to supply output that is sufficient for the metabolic needs of the tissues, in face of acute venous return. Common causes of heart failure are hypertension, valvular heart disease, ischeamic heart disease, anemia, and pulmonary thromboembolism. Clinical features: tachycardia, gallop rhythm, raised JVP, dependent edema, tender hepatomegaly, orthopnea, fatigue, exercise intolerance, and basal crepitations. Common precipitating factors of heart failure in cardiac patients must be considered in treatment of acutely ill patients: poor compliance with drug therapy, increased metabolic demands, e.g., pregnancy, anemia, progression of underlying disease, e.g., recurrent myocardial infarction, uncontrolled hypertension, cardiac arrhythmias, pulmonary embolism, infective endocarditis, infection, e.g., pneumonia. Investigations: chest X-ray may show cardiac enlargement as well as evidence of other cardiac or pulmonary lesions. 1. Hemogram to rule out anemia, infection. 2. Urea and electrolytes. 3. Electrocardiogram, ECG. 4. Echocardiogram. Management general. 1. Restrict physical activities. 2. Order bed rest in cardiac position. 3. Give oxygen by mask for cyanosed patients. 4. Restrict salt intake, control fluid intake, and measure urine output. 5. Measurement weight daily. Management pharmacological. 1. Furosemide 40 to 160 mg PO/d. Use higher doses in patients who are already on it. 2. Digoxin 0.125 to 0.25 mg PO/d. Useful in atrial fibrillation. 2. Loading doses for digoxin may be given to patients who are not on digoxin, beginning with 0.25 to 0.5 mg PO/qds up to a total of 1.0 to 1.5 mg and then put on maintenance. 3. Potassium supplements. Advise patients to eat fruits, e.g., bananas or oranges. 4. Prophylactic anticoagulation. Heparin 2,500 units SCBD in those patients who are on strict bed rest and marked cardiomegaly. 5. Treat underlying causative factors such as hypertension and anemia. 6. If patients fail to respond to above measures, consider angiotensin-converting enzyme inhibitors, e.g., captopril 6.25 to 12.5 mg PO/TDS. 6. Enalapril 2.5 to 10 mg PO/d, BD.